Welcome back. We're on location today in West Ashley at the Coastal Vascular and Vein Center. And today we're talking about varicose veins. Joining me today is Dr. Edward Morrison along with his patient Cynthia Dale. And first off, doctor, varicose veins can be very unattractive for ladies, and ladies are afraid a lot of times to wear shorts because they show the varicose veins. Yes. Tell us, what exactly is a varicose vein?
Thank you, sir. About 10, 12 years ago, we had a revolution in treatment of varicose veins. As you can see, I've been doing this a while, and we went for decades without doing much for varicose veins because the surgery was obtrusive and very invasive. The quantum leap came with the ability to understand that you can take care of veins with minimally invasive techniques. So we went from doing no vein surgery to one of the most common things we do today. Varicose veins occur when valves in the veins, which allow blood to go up and not down, become dilated. So as soon as you get out of bed in the morning, put your feet on the ground, blood goes in reverse and pools in your lower legs. Women have it at about 50 times the rate of men, and it has to do with various hormonal effects, pregnancies, etc. The long-term effects is as soon as you get out of bed and put your feet on the ground, blood is rushing in reverse in your superficial veins and pooling in your lower leg. And you may have everything from an unsightly varicosity to untreated chronic skin changes and skin ulcers. And believe it or not, we take care of myriads of these patients that the technology wasn't available until 10 years ago. But it is something that traditionally in vascular surgery was taught as being very benign and don't worry about it. But it's problematic to those who have it.
Tell us about the symptoms of varicose veins.
You may have anything from being asymptomatic, multiple large varicosities, to having pain, swelling, tenderness, itching. A lot of women and men with varicose veins will have night cramps, and because the veins are so distended all day long and the nerve endings hurt all night long, and they'll kick their legs all night. You can go to, as we mentioned here, chronic skin changes, to ulcerations. You can get phlebitis or recurrent inflammation in the superficial veins. God has given us a massive quantity of veins in our legs, and when they're dilated and blood's pooling down there, it basically hurts.
It hurts. Speaking of the veins hurting, bringing in your patient, Cynthia Dale, and what were your symptoms, Cynthia, that you had with your varicose veins? I mean, you're a beautiful lady, but you had these veins, and were they bulging? Were they just hurting bad? What were the symptoms?
Yes, my legs would just throb and ache, and like Dr. Morrison said, I'd have cramps in my legs at night. My left side would hurt so bad that I couldn't sleep on my left side at night. I'd kind of toss and turn, and yes, living here in Charleston, you know, it's hot, and I would always want to wear shorts or summer dresses, and I was unable to do that because they were so unattractive. I had these huge veins just bulging out in the back of my leg. My lower leg would actually swell a little bit, and it was just very unattractive.
Mm-hmm. You talk about, and doctor, I want you to come in on this as
Sure.
well. Yes, you
sir.
talked about your hip hurting. Tell us about that, because we talked about, before we started taping and talking all about this, what was with the hip hurting?
Miss Dale had she basically had a unique set of events. Not only did she have the typical superficial veins that were refluxing from the groin down, but based on her symptoms, we decided to look at her pelvic veins. Again, a lot of women who have gone to parturition and had multiple children, one or two, the veins in their pelvis will do the same things that the legs do. And again, pain, swelling, abdominal pain, all sorts of pain and swelling up in the upper thigh region. When we see that, it usually is a sign something's going on in the veins up here. Again, right in a room like this with a minimally invasive technique, without having to go make an incision, etc., we're able to take care of those veins right now with very gratifying results.
Talking about a lot here. We're going to come back with our next segment, talking about how that was taken care of from the doctor to the patient in just a little while. You can get more information on abcnews4.com.